when somebody is able to visualize the plaque in their arteries, their very own arteries, it has an impact on how they behave. Very different than seeing cholesterol particles in the blood, which are one step removed. First of all, we know as physicians, we understand that cholesterol is a risk factor and not the actual disease itself. And we understand that logically. I think for an individual patient, there's actually an impact additionally that's more emotional. Like seeing that number on the lab test is one thing, but seeing a very fancy picture of that artery and of the plaque in it, I think is very powerful. And it's probably the best case for some of these fancy 3D visualizations that some of the software companies produce, because most imagers don't think they're very helpful in terms of actually reading the case, but they're very useful when you sit down with a patient and show them a beautiful 3D picture that you can rotate on the screen that shows them, here's your artery, your pipe is narrow, you have disease. Look, it's right here. I can see it on this image. And making it in that pretty picture that makes it really easy for the patient to see it as well. And now they go, oh, it's time for me to get to the gym. It's time for me to get serious about that diet program. I think we can be much more prescriptive for patients about, here's your goals for your diet. The idea that somebody can get that CTA done, get their blood work done periodically, and then be able to see their clinician remotely on a regular basis, I think is the way of the future for sure. I mean, right now, heart disease is the #1 killer of people in the Western world, and it doesn't need to be that. Coronary disease is a multi-decade disease, and people don't find out about it. They don't start to feel it, have symptoms until much later. They have symptoms once the disease is actually very close to its endpoint, when it's severe, probably 10 to 20 years after it started. I'd suggest that 10 years earlier, you still have the disease. You just don't know about it yet. And using these tools, we can make the invisible visible.